Today, the committee continues its critical work on how to best support the mental health and well being of Americans who have faced ongoing mental health challenges. And of course, these have been exacerbated by the COVID-19 pandemic. While the need for mental health care is greater than ever, there are still too many obstacles for people to access that care. One in five American adults reported that the pandemic had a significant negative impact on their mental health, yet only 45% of adults with mental illness were able to access the mental health treatment they needed in 2020. And children, particularly children of color, are experiencing increasing rates of mental health conditions. In fact, in 2020, mental health emergency department visits rose by 24% or more for children between the ages of 5 and 17. Americans seeking mental health care face a range of barriers, including stigma and discrimination, workforce shortages, and concerns over the cost and coverage of care. And this committee has a long history of addressing these barriers to care, including ensuring parity for mental health and substance use benefits to other health benefits. We played a central role in both the passage of the Mental Health Parity and Addiction Equity Act and in the expansion of parity to individual market plans in the Affordable Care Act. Then last year, we led efforts to equip the Department of Labor, Treasury, and Health and Human Services with new enforcement tools to strengthen and enforce parity in the Consolidated Appropriations Act of 2021. This law requires insurance companies to submit analysis of their coverage of mental health and substance use disorder benefits to the three departments so that the departments can then provide an annual report to Congress on their findings. Unfortunately, their first report, which was just released, found that insurance companies are failing to deliver parity for mental health and substance use disorder benefits and are falling short of their obligations under the law. It's unacceptable that insurance companies are flouting the law. Clearly, more must be done to strengthen the protections of mental health parity laws, and we must ensure that Americans' health coverage includes robust coverage and access to treatment for mental health and substance use disorder benefits. Now, access to mental health has never been more crucial. Suicide remains the second leading cause of death amongst Americans aged 10 to 34. And we know that mental health challenges are often compounded. For instance, roughly half of Americans experiencing mental illness will also experience a co occurring substance use disorder. Thankfully, we took swift action to help meet the growing mental health needs of Americans during the COVID-19 pandemic. Through the fiscal year 2021 funding bill, the CARES Act, and the American Rescue Plan, Congress provided $9 billion to states, tribes, and localities to respond to mental and behavioral health uh, needs. And last year, the House passed nine additional bills that were shepherded through this committee that would support the mental health needs of healthcare providers and students, address inequities in services, and support access to the National Suicide Prevention Lifeline and its new 988 dialing code that launched this summer. And the House passed Build Back Better Act would provide an additional 175 million for a range of mental health workforce and community services. These are crucial steps in the right direction, but our work is not done. So as we spend more time online, on social media, digital platforms, that's going to continue to play a role in people's mental health and especially our children. So we have to do more to understand both the benefits and risks of this reality with social media as well. So let me just conclude by saying the committee is also working to reauthorize a wide range of substance abuse and mental health service administration programs that expire in September. And as we conduct this work, it's important that we hear from people experiencing mental health challenges and the experts. So I think this hearing is very important today, Madam Chair, and I want to thank all the witnesses as we look forward to hearing their experiences and their expertise. And with that, I yield back.